sponsored in part by Pediatric Associates of Dallas. Pediatric Associates of Dallas has been providing excellence in pediatric medicine since 1971. PAD has locations in Dallas and Plano and is now open 7 days a week because taking care of kids is what we do.
The following content is not intended as a substitute for professional legal advice, medical advice, diagnosis, or treatment. Always seek the advice of your attorney, advocate, physician, or other qualified health provider with any questions you may have regarding any medical or educational concerns.
Hi, and welcome to another episode of Empowered Dyslexia show and podcast. I'm Rachel Chambers.
And I'm Stephen Yearout.
And we're here to help you be a better informed partner in education. On this show, we're going to be discussing dyslexia and other related disorders, research, interventions, and various, and special education policy at a state and federal level. We're also going to be talking to experts in the field and other people that have had personal experiences with these disabilities. Thank you for tuning in, and we hope you enjoy the show.
So there's a problem. Your child or student is having major issues in class despite average to above average intelligence. They dread going to school, they cry in the morning, do everything they can not to have to go to school. Crawling around on the floor, getting in trouble, things like this. Teachers telling them that they're lazy or they just need to try harder. What do we do now?
First off, you are not alone. There are a lot of other kids out there that are struggling just the same as your kid. This is not an uncommon phenomenon. Dyslexia can be detected as early as kindergarten. There are screenings for this. And if detected early and these children are started on interventions that are given with fidelity, meaning at least 3 times a week at 45-minute time intervals, some interventions vary, then you're going to close that educational gap quicker, and they're going to feel that feeling of success, and their little self-esteems are going to skyrocket. So it's very important. And this method, or process I should say, of early detection is called Child Find, which is mandated by the state government of Texas. We have with us in the studio today Dr. Matthew Housson. He is here to answer some questions and then also to tell us a little bit more about the evaluation process. Dr. Housson is a clinical psychologist who founded the Housson Center, a group of psychologists, diagnosticians, and counselors who perform educational and psychological testing as well as counseling services for children, adolescents, and adults. So thank you so much for being here today, Dr. Housson. How are you?
Great. Thank you so much for including me. It's great to be here with you all and talking about dyslexia.
Yeah. So tell us a little bit, how did you get started and how long have you been in practice?
Sure. When I came to Dallas in 1991, I was fortunate enough to get placed at Texas Scottish Rite Hospital for my internship, and that's where I initially came to Dallas and wanted to study depression and clinical depression. But through my placement at Scottish Rite, I was lucky enough to know the faculty and staff there, and I got involved with dyslexia and childhood learning disabilities and really fell in love with it. So that after I finished graduate school, I went and worked at the University of Texas at Dallas Collier Center, and that was in 1995. And so for 23 years, I think I've been, working with students who have learning disabilities, attention disorders, and autism.
Okay.
Dr. Housson, can you give us an explanation, kind of explain to us about the 4 Ds, dyslexia, dyscalculia, dysgraphia, dyspraxia, and kind of what the red flags are, or what to look for?
Sure, absolutely. Certainly what we look at, especially young children, is the presence of either motor delays or language delays. So when we're talking about dyspraxia, you can think of dyspraxia as a motor processing disorder. So certain children can have oral motor dyspraxia, which is going to affect the oral motor mechanism.
Like their speech.
They may stutter, they have difficulty forming sounds.
Okay.
With handwriting or motor dyspraxias, This is a lot of the challenges that children who have dysgraphia. So we say dysgraphia is really a problem with handwriting. The way that I think of dysgraphia is I'm right-handed. If I wrote all day with my left hand, I would be a pretty frustrated fella by the end of the day. So dysgraphia refers to fine motor-based difficulties that's going to affect initial letter formation. And as students get older, it impairs their written expression. So these are students who you'll see a lot of frustration because they do not like to write. With dyslexia, dyslexia is a deficit in what we call phonological processing. Phonological processing is the ability to put sounds with symbols. And so for students who have early ear infections, hearing difficulties, it certainly can impair the development of that sound to symbol correspondence. So parents, I think it's important when they're looking at their 3 and 4 and 5-year-olds, if there's history of language processing difficulties, speaking with their pediatrician or seeing an ENT, just to make sure that that ear's working the way that it's supposed to. If not, it's like hearing underwater.
Right.
And if you hear underwater, you can't process sounds effectively, which means then it's difficult to hear the phonemes, which are the basic units of our English language. There's 44 phonemes in the English language, and if you can't hear them, then it can set up the risk for dyslexia. So language processing difficulties, difficulties with rhyming in young children, and then as children move into kindergarten, we want to make sure that they're able to identify and then retain the letters of the language. And that is the early risk factors for dyslexia. Moving into first grade, we look for difficulty with word decoding, which is just the ability to look at a word and unlock it. And we look at the difficulties with spelling as another characteristic of dyslexia. And then it moves in from word analysis to accurate or fluent reading onto spelling. The last of the D's is dyscalculia, the hardest to say.
It's so hard to say.
The way we think of dyscalculia is calc. What's calc? It's math. So dyscalculia is a disorder of math. The risk factors for dyscalculia, we look early at kids who maybe have visual spatial problems. Actually, language processing difficulties is a risk factor for a math disorder because there's a language around math. More than, less than, equivalent to, that's all language. And so students who have language-based processing problems may be at risk for either difficulties with math word problems. So that's a factor. The other things that we look at with dyscalculia is problem with retention of math facts. There's an automaticity that's involved in math. When you're in first and second and third grade, you have to do it quickly. And so a lot of children who have cognitive processing weaknesses, they're just slower in the speed at which they process, like an old computer. They may have difficulty with automaticity of math, which then slows down their ability to do math calculations efficiently.
Okay. So you had said, so basically at the beginning you had said ear infections and stuff. So you kind of want to rule that out first to make sure their ears are good, that they're not full of fluid, like what I see at my work a lot. I see a lot of ear infections. And then once you realize that they can hear, then you
Then
look at
learning's
other,
supposed to progress like it's supposed to.
like it's supposed to.
Exactly.
And then if it doesn't, then there might be a problem.
Yeah, so I think you just want that plumbing of the ear to be working.
For
If
sure.
it's stopped up, then I think it impairs kind of higher level neurology and learning. So that's at the youngest age. As we move into kindergarten years, that's where we want to make sure that children are getting adequate education so that then they're beginning to solidify their word decoding skills so that they can go on to read and go on to do math and then go on to write.
So what are some red flags, like a parent at home or a teacher in the classroom of a child like in kindergarten or first grade? What are some red flags,
Telltale signs.
signs that there's a
You can
problem?
go, yeah, we need to investigate this more.
Yeah,
Sure,
what does it
absolutely.
look like, I guess?
That's great. When it's a great question, and the way that I think about it is there's academic red flags and there's emotional red flags. So the emotional red flags, I'm a psychologist, we'll start there. The emotional red flags are certainly frustration. So I can't do it, I'm not smart enough, my friends read better to me. Those type of statements, we all have our days where we don't feel as good about ourselves, but if there's a consistent theme of I'm not doing well, that needs to be attended to by parents. With the academic red flags, this is where the parent-teacher conferences are so important, to go in and meet with the child's teacher and get a sense of how are we doing on just retention of the alphabet. That open dialogue's critical, and an awareness of, can they retain their alphabet? Can they retain knowledge of the alphabet symbols? That's just showing them a flashcard and remembering that's a P rather than a T or a D. Moving on to then, after we look at symbol recognition, can we look at sound to symbol correspondence? So does B, what does B and R mean when you put them together? What does O sound like? What does O sound like when you put it with U? So our language builds on itself. It's a process, and if students aren't from the beginning learning symbol recognition and then sound symbol correspondence, those would be indicators with dyslexia that there may be a problem. For math, certainly with math, it's a little bit harder to tell in first and second grade about math disabilities. A lot of times students who have attention difficulties will struggle with math either because of carelessness or they're having trouble with retention. So many times students with dyscalculia don't get diagnosed until they're a little bit later. We've gotten pretty good at diagnosing reading at kindergarten, reading concerns at kindergarten and first grade. It's more challenging to do that with math.
When does that start? Third grade, like
Math
with
is
the
typically
times
third
tables?
grade. It's a little bit easier, in third and fourth grade
To
to
detect it.
identify the
Okay.
dyscalculias in the students.
That's
Okay,
when
that's-
the kids start learning their multiplication
Their
tables.
times
and
tables,
that's
you
when
bet,
it
which
goes
is,
kind of haywire for a lot of kids.
Well, and I
Yeah.
think we're really good with dyslexia. I think that in math disorders, it's harder. And then kind of the silent one that really does affect a lot of kids is the handwriting
I
difficulties.
was gonna say, and then dysgraphia, when do we start seeing that? Because,
I think dysgraphia shows up a lot earlier than we think
Yeah?
it does.
Okay.
So, dyspraxia is an umbrella term that refers to motor weaknesses, like we were speaking about
like they're
earlier.
fine motor,
It can be
right?
fine or gross. And
Or
so
gross, okay.
typically if a student is a clumsy child who's uncoordinated, those are gross motor indicators.
So you're not just talking about handwriting, you're talking about
The
motion,
the motor system.
tripping over a flat
Absolutely.
surface,
Yeah.
that type of stuff,
When we
falling
think-
off of chairs.
Absolutely.
Those type of things.
Those can be indicators. So we, neurologically, we feel like that lives up here in the frontal and prefrontal part of the brain.
Okay.
And those functions of the brain are meant to control both fine motor functions and gross motor functions. So with dyspraxia, students who have coordination or gross motor difficulties, these students a lot of times can have weaknesses in their core, their body core, so it makes it harder for them to sit in a desk and sustain the stamina. So a lot of times these students may slouch over, lay their head on the desk just because their muscles in the core of their body get tired.
Okay.
That's a stamina problem. For fine motor difficulties, that is where you can see it with kids who maybe have difficulties with Legos. They don't like to color. Kids don't color anymore.
Right.
They use the
know.
iPad.
I
And
know.
we're seeing that without
They need
that
that
practice,
practice.
you're not developing some of those fine motor skills.
And without the schools teaching cursive anymore, we're gonna start that identification. I can see that being pushed out even further because they're printing everything.
Absolutely.
Is that right?
And so
It's gonna be a lost artwork.
Yeah.
The cursive, I feel like. but,
That's right.
you know.
So I think it's important for parents to look at how does a child grip a crayon or a pencil. The way that we're supposed to write is a good tripod grip where they're holding the pencil and getting a good grip so that you can manipulate that crayon or that pencil. And from there with handwriting, difficulty writing their name, I don't like to write, that fatigability is a common risk factor for students who have dysgraphia. And the thing about dysgraphia, it's really quite workable. We can work with fine motor therapist or occupational therapist to develop exercises that just strengthen that connection between the fingers up to the brain.
Okay.
So we're saying that it can be remediated.
Very
with,
remediable.
with good therapy.
In early identification, because remember,
Absolutely.
like anything, writing's a habit.
Right.
And so if you learn to hold a pencil like this or like this, that's muscle memory.
Would
Right.
that even be holding your utensils, like your fork and your spoon?
Yeah.
They may hold it.
Yeah, they hold
Like
it just
this?
to compensate because the muscles are not working the way that they're supposed
Okay.
to. But
Yeah.
if you can go in and identify where are the muscle weaknesses, it's really fixable.
Okay.
It's more entrenched as they get older.
Yeah. Yeah. Okay. Well, that's probably like with language, speech too.
That's exactly right.
You have to get that early
That
as well,
patterning
so your
is
tongue
really important.
doesn't. Or I don't know that much about.
But you're right on. That's
Yeah.
exactly right.
Thanks.
That's exactly right.
All right. Well, let's move on. Let's talk about some of the comorbidities that go along with dyslexia, dyscalculia, or what do you
Absolutely.
see?
Well, I always say it's the brain, right? And the brain, rather than living in compartments, is really very integrated. So anytime we're talking about learning disabilities as a broad umbrella, or attention disabilities, or emotional difficulties, there's a high degree of comorbidity between the 4Ds. Some studies, it's 20 to 40. Some studies say 50% overlap between, for example, dyslexia and dysgraphia.
Oh, okay.
So we see a high degree of overlap between the specific learning disorders, as they're called.
Okay.
Then when we move into the attention disorders, specifically attention deficit hyperactivity disorder, we used to call ADHD, ADD, or ADHD. Now we call ADHD inattentive type, which is the inattentive type difficulties, or we call it ADHD hyperactive impulsive type. Or if the student has both, it's ADHD combined type. So the comorbidities between the ADHD disorders and the learning disabilities is up to 40%. Studies vary, I would say 20 to 40%. So you've
Wow.
got a pretty good shot.
That's a big-
It's a pretty high degree of
It's a lot
comorbidity.
bigger than what I was expecting, because I was
Right.
always heard like 20 to 30, but I didn't think
It can go
on up to 40. And then you said dysgraphia 50 up to 50%
That's right.
possibly.
There's a high degree of overlap. And so attention disorders are a common rule out when we're looking with younger kids, because certainly if it's difficult to attend or focus, then you're not picking up those phonics, or you're not learning those pencil strokes, or you're not attending to instruction on math concepts. So we feel like attention disorders are really important to identify early and rule out, so that we can be sure that you're dealing with a specific learning deficit rather than an attention deficit.
Gotcha. And like, what's the age you think of truly diagnosing?
Attention disorders?
Yeah.
We need to look at it in kindergarten.
Kindergarten too. Okay.
Absolutely.
There
Wow.
you go. Okay.
And pre-K in some children, it's younger students who have hyperactivity difficulties or attention difficulties. If it's impairing social relationships in pre-K, or if it's impairing learning in pre-K, those children should be watched closely.
Okay.
And it's important to say, when we're talking about identifying, we're not talking about using specific treatments like medication or necessarily behavior therapy. We're talking about seating placement, accommodations, because at the end of the day, what we want for all students with learning disabilities is, this is my role, happy walking in the school and happy walking out of the school.
Most
If a student's
definitely.
not happy walking in or not happy walking out, we need to identify, is that an attention issue, is it a learning issue, or is it an emotional issue? So the third comorbidity, I would say, is in the emotional domain. You certainly can have younger students who are struggling with learning show anxiety symptoms. A lot of times anxiety presents itself as physical manifestations. Tummy aches, headaches, I don't want to go to school,
Crying,
refusal.
I'm not getting out of bed.
I'm not going to school today.
I hate it. I hate my teacher. All those type
All
of
of
things.
those
yeah.
are clear things. We've all said that at times, but on a theme.
On a
But if
certain
it's-
day,
if
but
it's-
if it's every day, right?
Yeah, if
then
it's an
that's
ongoing, every day I go in to get my child up, and I don't want to go. I hate school. I don't. Yeah.
Exactly.
we need to start looking.
That's what we
Is
have
there
to
other
pay attention
issues?
to.
Yeah.
And just like learning disabilities and attention disorders, anxiety and depression we know run in families. So something we haven't really talked about is just the genetic risks that unknowingly, unwillingly, undesirably, we sometimes pass on our good genes and our bad genes to our kids. Bad genes, I think, is not really the way to think of it, because we know that there's positives of all of these conditions, but those are risk factors. Depression, we typically don't see show up until, I would say, second, third, or depression symptoms, right? So depression symptoms are more, they can be cognitive symptoms of depression. I'm not very smart, nobody likes me, I'm not good at learning. So more of that negative mindset that we really need to attend to. That, just like bad handwriting habits, those can be, that type of negative thinking can become habitual. And if we're habitually negative, then that does set us up for more significant mood difficulties. So
I
those are
can imagine, you know, that child sitting there, constantly replaying, I'm not good enough, I'm not good enough, I'm not
Absolutely.
smart enough. You know, obviously that's gonna bring or exacerbate that depression, anxiety, you know.
I think
So-
that's enemy number one.
I
Yeah.
think it's going to be the cause of it. It's going to be like, that's why they are.
I mean, I remember that feeling. I mean, when you're sitting there talking about it,
It's a
I
bad
remember it.
feeling.
It is.
Even though that I feel like I've gotten past it, it brings it back
Sure.
that quick.
And you can connect back
Yes.
to it, because those are deeper down,
Deep
deeper
insecurities.
inside their limbic system, or
Yes.
the emotional part of the brain. And so with all the early identification that we know and all of the resources that are available, it's a really kind of golden age in terms of identifying and helping these students and families who have various learning challenges we've been talking about today.
Okay, once the request for evaluation letter is sent to the school, how many days does the state have to complete the full individual evaluation, or FIE? I mean, I've heard that there's no state or federal mandate on how long it takes to complete a dyslexia evaluation
That's right.
under 504. So I guess if you could answer those two
Sure.
questions.
So under the IDA, the Individuals with Disability Education Act, the law says that schools have 45 days, school days. That's an important point. It's not
School
45 days,
days.
it's 45 school days,
So that's what, like,
Monday through Friday.
what is that?
Monday through Friday. And so that's
8
usually,
weeks? 9 weeks.
if we can get it done in 8 weeks, 9 weeks, we're doing pretty well with holidays and things like that. So 45 school days from the time that the parent signs the written authorization to begin the FIE to the completion of the FIE. You're right, on the 504, there's no state or federal mandate in terms of how long schools have before they can complete a dyslexia assessment. And we feel that needs to be changed.
Yeah, I mean, because time, like we just discussed, time is kind of the essence to help these kids and get their detection done early, their intervention started off.
Absolutely.
So-
In the reality, we have 13 years for our kids to be in school. And if we're waiting till grade 3, we've lost so much
Lost a
time.
valuable
That
time.
gap
Too much
is
time.
is way, it's
It's
almost,
widening.
It's widening, and it's almost, you almost can't fill that gap if you continue to let it go and go.
Right? Is it harder for them to?
Well, absolutely. And, if you think about a kindergarten or first grade student, psychologically, they're typically pretty happy-go-lucky,
Right.
and things roll off their backs. End of second grade, beginning to third grade, our self-concept becomes, less like putty and more like cement. Not solidified, but
Right.
certainly we're starting to move towards, I'm fast, I'm slow, I'm smart, I'm not smart, I'm a good reader, I'm not a good reader.
Worried about what other people think about us.
Absolutely. There's a lot of that social comparison and social awareness that third graders are way more socially aware than they are in first grade. And so we feel like identifying these red flags we've spoken about and then beginning the assessment process so that we can identify who needs a little bit more help versus who needs a empirically supported reading curriculum,
Okay.
if we're seeing the characteristics of dyslexia specifically.
So Rachel asked about a FIE, full individual evaluation, and a 504 testing.
Right.
Can you give us, what are the differences between the two?
Sure. So we'll start with an FIE, which stands for Full and Individual Education Assessment. This is an assessment that's typically a multidisciplinary assessment. It's completed by different professionals at the school. And the law states that if a child's referred for an FIE, it needs to be a comprehensive assessment. Intellectual testing is a part of an FIE, academic testing, an evaluation of motor functioning, language functioning. Those things can be screened. More in-depth evaluation of anxiety, mood, behavior, attention is all encapsulated in a FIE evaluation.
That's the full shebang.
That's the full shebang.
So we're getting a good picture of what's going on with that child.
Yeah, no stone is left unturned, I think.
Shouldn't be.
Shouldn't be,
That's
right.
exactly right.
That's the goal anyways.
Exactly right.
So what about a 504?
So in contrast, a 504 is a more circumscribed assessment. It's typically done by a campus level, either reading interventionist or the dyslexia specialist at the school level. So if we go back to what is dyslexia, well, a 504 assessment drives the data that you collect. So in a 504 or a dyslexia assessment, you're looking at phonological awareness, you're looking at word recognition. This is where students will just read from a word list to see if they can decode the words accurately. We're looking at reading fluency. So it's a much more shortened hour, sometimes 2-hour assessment to look at specifically dyslexia. In contrast, an FIE is a 6 to 8 hour assessment with the child, not to mention the records review that the licensed specialist in school psychology will complete, or the school's educational diagnostician. So a really good FIE is comprehensive and involves records review, working with the student up to 6 to 8 hours, doing IQ measures, academic measures, measures of phonological processing, measures of arithmetic, measures of writing, screening or investigating social, emotional, behavioral functioning.
Okay.
So it's much more comprehensive.
Much more comprehensive. So, so when you say 6 to 8 hours, explain what it's like for that child to go, let's just say, into your office.
Sure.
I mean, they don't stay in your office for a whole day.
Absolutely not.
So how do you do it?
Yeah. So we really look at developmental level. The longest that we will test a student is 3 hours.
Okay.
But that student needs to be typically past puberty. So we've spoken a lot today about younger learners. For 5-year-olds, it's often an hour of time, and then we call it a day.
Call it a day.
So 6, 7, 8, 9-year-olds, depending on their developmental level, if they can work for 25 to 35 minutes, take a break, get themselves kind of, re-ready to do some more work, we'll typically do 3 2-hour days of testing.
Okay. So you break it up for them.
And we really are looking at what is going on with that child. If our attention's done or we've got a stuffy nose, we need to call it a day.
Well, and then also you get to see them on 3 different days.
Which is the beauty of it.
Yeah, or maybe even 4.
Exactly.
To get a better picture. I think that would give you a better picture and get to know the child even better.
That's exactly right.
So, okay.
Dr. Housson, in your private practice, do you lean more towards doing an FIE or do you lean more towards the 504 version of the dyslexia evaluation? And the reason why I'm asking this question is because a lot of times the schools want to separate that out, and unless there's really a blaring obvious need, they want to go towards the FIE versus the dyslexia 504 evaluation. So can you kind of talk about that?
Sure. We're in private practice, so it's a different world. Our feeling is we do what's called a comprehensive psychoeducational evaluation. It's going to be like a FIE. In that evaluation, we are looking at intellectual functioning, academic functioning, motor functioning, emotional functioning, social functioning, and the evaluation's built that way because for students who have dyslexia or attention difficulties, we really want a comprehensive picture of aspects of the child's learning, such as their stamina, their self-concept. And if you miss those pieces, then when you go to targeting your intervention, we feel like there's a lot of missing data. So we will do a targeted dyslexia evaluation in certain situations, but I feel like for younger students, it's really important to have a good baseline of all aspects of their learning. And from there, that's a springboard in kind of setting up the right programming. And if the programming is working, then we can come back and do a really targeted dyslexia intervention or attention, not intervention assessment. We can do a targeted dyslexia assessment or attention assessment. My perspective is very much comprehensive is better.
What I hear you saying is we need to make sure that we have all the data for this child to make sure that the plan is right. If we don't have it all, you're going to you take the risk of missing something, a key point of it, a key part of it.
Absolutely. So that's best practice. Best practice is not always practical, but we certainly need to strive to get to those best practices assessments.
If a family wanted to come into your office,
Sure.
and do a dyslexia assessment and or a FIE,
Sure.
what's the average cost for those type of tests?
Sure. You know, the way that we'll talk generally and then we'll talk specifically at
Okay.
our practice. So generally, if we're doing a circumscribed dyslexia assessment, that's a 2-hour assessment with a parent meeting. Those usually will range from $750 to $1,250. If we move to an FIE where we're really using 10 hours a time in our group, that's a $2,500 evaluation. I think that if we go into different communities, I would say the range is anywhere from, for an FIE, a full evaluation, is $1,500 to $3,000.
Okay.
One of the things that we feel super strongly about is the importance of a school visit. And so as families are kind of talking to different evaluators, I would really encourage families to talk to evaluators who include a school visit in the assessment. I always say that I feel like I'm fighting with one hand behind my back in the summer when we do an assessment. I don't get access to the teachers. I don't get access to the classroom.
Mm-hmm.
And those are variables that are really relevant in terms of, is this an attention issue? Is this a teacher-child dynamic? Is it a child-student classroom dynamic? We need to really look at all of those variables as we're kind of sticking to the motto of happy going in, happy going out of the class.
So you go and just, you're like
Do
a
you
fly on the
do you
wall.
shadow the child, something like that?
We're flies on the wall, exactly.
Flies on
We
the wall.
typically sit at the back of the room, and the student, you know, we're anonymous to the student. We're
They don't know
watching
you
the
yet.
classroom. That's exactly right. We're watching the classroom. And we're just getting a sense of how do we do in circle time? How do we do at the desk? How, if there's a social problem, we will schedule the school visit on the playground or at recess. So
that non-structured time.
absolutely.
Right.
So we really target the intervention to the need. If it's a concern about attention, we want to see independent seat work. If it's a concern about reading, I want to watch the student while they're doing their small group reading intervention.
Okay.
And it's really helpful. And in addition to that, we have questionnaires that are both standardized that we ask teachers and parents to fill out, and then qualitative. So we're asking the teacher, what are the student's strengths? What are the student's challenges? What are areas of opportunity? What has been done to support this student?
Right.
Because so much of what's important, especially with our younger students, is identifying either an issue or a risk factor for an issue, providing intervention. So we hear a lot about RTI, which is response to intervention.
Right.
Because we know that not everyone's going to end up with a clinical diagnosis of one of the Ds, but they may, because of developmental delays or illness or family stress, they may be lagging in the development of some of those skills. So we'll want schools and parents to provide early supports. And most of the kids are going to respond to those supports and do better. So the response to intervention model, we really feel good about in that it has increased the importance and awareness of early identification and the need to get in there and support kids who are showing some of these risk factors.
So that's all the questions we have for you today, sir. Let's see, if you attend public school and you would like to get your kid an evaluation, or your student, your child, we are going to put a template of a letter that you can send, email, mail, hand deliver to your school's counselor. So we're going to put that template letter on our website, which is empowerdyslexia.info. Again, that's empowerdyslexia.info.
The template will be under the download section.
Okay, there you go, under the download section. And one more time, I want to just give a shout out to 3dudesdesign.com. This is a t-shirt company that was inspired by their 3 amazing smart boys. You'll be sure to find their comfortable, custom designed t-shirts for the dyslexic person in your life, along with other awesome designs. Please go check out their website, 3dudesdesign.com.
I hope you've enjoyed this episode of Houston, We Have a Problem. Knowing is half the battle. Please take the first steps in getting your child tested. You'll be glad that you did, and so will your child. Starting the process is a step in the right direction. Thank you for joining us.
Today's podcast has been sponsored in part by Pediatric Associates of Dallas. Our dedicated team is committed to delivering quality and compassionate care to generations of children in North Texas. PAD has locations in Dallas and in Plano and is open 7 days a week.